Hi, I'm happy to introduce you to the weight loss management webinar. And I'm going to show you and share my screen to show you the slides. Here is the Zoom share screen. Here it is. So that's the first slide, actually, to encourage you, if you're Spanish or if you're French, to go on to the interpretation, because we have two interpretations, one in Spanish. Haga clic en interprétation, and pour la interprétation française, cliquez sur interprétation français dans l'icône dans le bas. Then I'm really happy to introduce you to what works in weight loss management. And you will see there are many probably surprising information, but strong information that you will get. There's much more information in a model I'm presenting, actually, we'll present later. But I'm happy to introduce you to Dr. Andrew Heyman, who is actually professor, fellowship director of integrative medicine at the George Washington University. He is also creator of one of the largest academic-based integrative medicine programs in the US during his 16 years at the University of Michigan, and a medical director of the Metabolic Code, focusing on health technology and education. And he oversees in the A4M, the biggest anti-aging movement in doctors and health professionals, where he is really a director of academic affairs for the A4M. But I must say, he also has a big heart. And he's very spiritual. I know, I saw some of his lectures. So, Andrew, can you maybe, I'm going to stop sharing. Can you maybe say a few words to the public, and what maybe your goal is actually in medicine, what you want to transmit?
So thanks for having me. I really appreciate it. It's a real honor to be here and to have an opportunity to speak with you and to speak with all these wonderful people that are listening really around the world. And, this is a topic in general of integrative or natural medicine that I've been involved with for the past 30 years. And, my goal has always been the same, which is to hopefully be an advocate for change and to help transform medicine into something that's a bit more humane and patient-centered, that really focuses on the needs of the individual and that understands that each person is different in their health journey, um, and hopefully to be very aspiring to the notion that everybody wants to live their best life and to feel vital and to feel well. It's a real privilege for me as a physician to help my patients walk that journey. And I hope to share a little bit of that knowledge and wisdom today with you and to your audience.
So just to tell the public, I'm going to have a 50, 60-minute lecture on weight loss management with a lot of tips. And then you will be interviewed, Andrew, and I think it will be really exciting. And then the audience has the possibility of asking questions, and we'll privilege the questions on your topics, as you will see. So, okay, now you can take out your audio and your video, Andrew, and see us in about 50, 60 minutes. So let me share my screen again, get back to my presentation. And we have here, first of all, I want to present the categories of overweight and obesity. Categories based on the BMI, the body mass index. You see that an overweight person has a BMI between 25 and 29.9, and you'll see that some have a very surprising BMI. In one of the next slides, you see the obese class is class 1, is between a BMI between 30 and 34.9. The BMI is based on the kilos per square meter. Um, and you see that obese class 2 goes to 35, 39.9, and obese class 3 is 40 or more of BMI. And you see that in the Polynesian islands, they are beautiful and attractive. You see all these beautiful Polynesian islands, but actually in the It's probably an obesity trap. If you go live there, you probably are very likely to be obese because they have the highest obesity rates. When you look here, the American Samoa is top of the world. More than 70% are obese, so BMI of 30 or more. And you see these obese, morbid obese, or super obese. Well, in the United States, almost 42% are obese, BMI of 30 or more of adults. And in Qatar, it's quite similar, Kuwait, Saudi Arabia. So the Arabian countries also are not so good there, especially the rich countries. And United Kingdom is also more than 25% of obese persons. Belgium, almost 20%. That's too much for us. And the Netherlands do much better, 15%, and France just 10%. And of course, you have very poor countries in Africa where the rate is much lower. But so how to actually lose weight? And I made a model on a weight loss management program that has about 11 sections. The first section is very short introduction, but very interesting because it goes not only on physiology of obesity, but also it talks on the heaviest persons ever with pictures. And we'll see one of those just in one of the next pictures. And so there's an efficient psychology and lifestyle adjustments. The most sessions are about 2 hours. Efficient diet, and you will see it's more the paleo diet. And then there are 13 ways to reduce appetite. The nutritional therapies, a session on how nutrition can not only decrease appetite, but also improve your body composition, also hormone therapies like thyroid, growth hormone, testosterone, DHEA, and then how to reduce also hormone excesses like cortisol, insulin, estrogen. Also, it talks about appetite-reducing hormone therapies like the glucagon-like peptide 1 analogs, the ACG, leptin, oxytocin. You'll see some surprising pictures there. And reducing the levels on effects of appetite-increasing hormones like ghrelin and adiponectin, and also a special lecture on local fat deposits, what's behind that hormonally, and what you can do. And also patient case, some practical patient case. So let's go and see some of the tips I can give based on those lectures. So let's look first at efficient lifestyle and psychological attitudes to slim. It's a whole picture, and you will see that psychology is very important when you as a health professional address yourself to somebody with a weight excess. There are several things. Among those, there's use positive messages and words. Among others is also to actually do sports, as we will see in some of the next pictures, and also other items. There's a lot of items. Really, psychology has an efficient intervention in reducing weight. So it's very important for health professionals to use better terms. The terms like excess body fat or obesity are really considered offensive by many of patients with weight problems. So don't use those words. Don't say you're obese, but use words like you have a weight problem or a body mass index or excess weight. That's acceptable. Be more neutral in your terms. We know that this is a general trend in medicine not to use words that are offensive. And then, very important, we see this in a study on young adolescents that become later, 6 years later, young adults. Well, the risk of them to have a weight excess in female adolescents is lower if they have a strong perception that their parents care about them and their environment cares about them. And if they have a higher self-esteem, which is also a consequence often if you get more attention, positive attention from your parents. And also there are factors that increase the risk of weight excess in these female adolescents if they're young adults. The ethnic, like African American, Native American, because often there's still discrimination, which is I don't know how it's possible still in this world to continue having that. And there are factors also that increase the weight excess in male adolescents. And, males are uh, rebelliant. They don't want to have people having the control. So they feel that parents trying to control their diets, there's more risk that they will compensate by eating more and getting more overweight. And then, very important to inform patients also with positive recommendations. So if you explain to a patient the association between weight and a disease that it can come from that, and you have a positive recommendation to give, do it this way, for example. Losing 10% of your current weight would improve your blood pressure. Don't say, for example, if you continue on and you don't lose weight, you will eventually develop congestive heart failure. That doesn't, so those words don't work. It's negative. Don't try to see it positive and show them the improvements they get when they lose weight. And then you have to tackle in people, especially with massive obesity, with erroneous belief that the most extremely obese patients they believe in a scenario, and they have 4 erroneous beliefs that are frequent in those people with extreme obesity, with extreme overweight. Try to use positive words, and they believe that additional efforts are futile because they have made several attempts to lose weight and it never ended with success. And then they believe that weight is maybe just a primary cosmetic issue, but appearance is not really a concern. There's no real reason to lose weight. So you need to tackle these erroneous beliefs and talk about it that they're not true. It's beliefs, it's not reality. Weight is fully determined by genetic factors, is also a belief they may have. And attempts to lose weight are useless as you would try to attempt to grow taller while you're an adult. Or another belief can be that ideal weight must be achieved to have a health benefit. Therefore, modest weight loss is not valuable. So you have to tackle those beliefs. And I'll show you a picture. Here's the second heaviest ever recorded human. Khalid bin Mohsen Shari is born in 1991. He still lives today, okay? In 2013, he was 620 kilo and is living in Saudi Arabia. And the king of Saudi Arabia said, look, we'll give you a team of doctors to help you to lose weight, but you must lose weight. Give the example. And see the example that he gave. That's 4 years later. He lost 542 kilos. And here's his 68 kilos, 150 pounds. And he was 1,370 pounds. At peak level, his BMI is 204. Imagine, you're already in the obese category if you're above 30. So this means that it's possible to lose weight, however heavy you are. Of course, he also was helped. He had a lot of doctors' team, people encouraged him, put him on lower diet, put him on exercise. He had operations to remove some of the fat, and especially the skin that was hanging after weight loss. But he made it. It's always possible. I don't know if it's so healthy to lose so much weight in so short a time. But anyway, he made it. Shows that it's possible to lose weight even if you're enormously overweight. And then some of the things that are important to say to your patients is that sedentary people who follow a weight loss program compared to people who do exercise, they include exercise extra supplementary to what they did before to their weight loss program. Well, those who follow the weight loss program, 95% of them regained the weight they lost in the previous year. Why? Because they just don't move enough. You need to move. And those who physically start exercising with a weight loss program and continue exercising, only 35% of them regain the weight. So when a patient says, look, whatever I lose, I regain the weight again, it's often because there was not supplementary exercise. So you need to do exercise. And there are so many recommendations. You can say a body that does not exercise, does not move, rest, and increases in weight. Then let's look at another session of the model is the best diet for slimness and health. What is the diet that is best to lose weight? In my experience, is a diet that optimizes hormone and nutritional levels. So your body functions better, will lose easier weight. Calorie consumption will increase, and you will have more movement, so you'll consume also more. And so it's actually the Paleolithic diet. So what is the Paleolithic diet? That's the diet of our ancestors. We still have a prehistoric body. We may be proud of our body, but it's similar to the one of humans 10,000 years ago. And what they ate as a diet, our bodies adapted to it. They ate foods that existed millions of years on planet Earth. And so this person is eating a sort of Paleolithic diet because salads and tomatoes existed a long time before. Maybe we didn't have tomatoes in European countries, for example, but we had other foods that we're still eating now or still are available. And so what is the difference between the Paleolithic diet and is that when other diets, in the Paleolithic diet, you have nuts, berries, vegetables, fruits, but the most of the diet, they were hunters and gatherers, was based on prey, on meat, on fish. And they also eat unprocessed foods and organic foods. And that's probably the way we need to eat. That's the best diet for the hormones. It's also the best diet, as we will see, to lose weight. Compared to the Western diet, that includes a lot of other foods. Additionally, you have sweets, alcohol, coffee, you have fats, oils, and sweets here you see, milk products, dairy, you have processed foods, and they have with pesticides on it. And then there's based actually mostly your first breakfast, first meal in the morning, well, bread, grains, and other starches. And so meta-analysis of 21 human studies published in 2021 showed that, for example, the paleo diet on long term showed that people lost about 8.7 kilos by switching over long term on a paleo diet, more than a year. And they didn't target to weight loss, they target health. But most of them were overweight and they lost weight. When you compare to a healthy diet that's proposed, you also lose weight with healthy diets, but not as much. A healthy diet on long term, you lose about 5.8 kilos. So still better with the paleo diet. And the control healthy diets were better than, of course, the westernized diet where you keep on increasing in weight. And the same information with much more studies is in short term. Paleo diet is more efficient than controlled diets to lose body weight and fat mass. And so also an important item is that what you eat in the morning, if you eat only in the morning compared to only eating evening, you will generally lose more weight by just eating the same quantity of food in the morning than in the evening. So persons who are eating only breakfast as a meal, they could eat as much as they want, lost 1.4 pounds per week. But if you limited that single meal per day just to 2,000 calories, they lost more. They lost 2.5 pounds per week, which is a bit more than a kilo per week. So you will see, I eat actually my main meal in the morning and not in the evening. My smallest meal should be in the evening, as you will see a little bit later. So after 2 p.m., you should stop also eating meat, poultry, and fish. Don't eat proteins in the evening. And you should also stop eating after 7 p.m. That is the best to have an optimal weight. Why should you avoid proteins in the evening? Well, we'll see that a little bit later. It's just to remind you the device that you should eat breakfast like a king. And that's the best. That's the sort of breakfast you eat. So what we eat generally, the warm meal, should be actually the breakfast, our breakfast. And we should eat lunch like a prince. That should be our lunch. And supper like a pauper. Very little, or it should be boiled vegetables is good, or no food in the evening. And then you have 16 hours intermittent fasting, which also helps health a lot. 3 meals a day is actually too much. I say often to my patients, uh, with 1 meal a day, you lose weight. With 2 meals, you maintain your weight. With 3 meals a day, you actually gain weight. But if the third meal is just vegetables, 500 grams of vegetables is on average 100 calories. That can be okay. So if you want to eat in the evening, eat boiled vegetables. That's not very calorie rich. Also, it's important to avoid cooking at high temperature. Trans fatty acids, if you want to have a normal weight. At more than 90 degrees Celsius or 195 degrees Fahrenheit, you actually create in your food often trans fatty acids. And they are made when you cook fish at high temperature, vegetable oils, you get trans fat. You should never, in my opinion, cook with vegetable oils, even coconut oil. There's some very small percentage of unsaturated fatty acids that convert to trans fatty acids. So this is a healthy fatty acids, oleic acid, and oleic acid becomes, by cooking with olive oil, you become oleic acid, which is known to be toxic. And that's how it looks. It's rigid. It doesn't move. Well, it's very flexible when it's a cis fatty acids. And so a study has been done in monkeys to see what it does on overweight, to eat a lot of trans fatty acids. And you see, for 6 years, they had 8% of their food was trans fatty acids, compared to 8% of the food being cis monounsaturated fatty acids in another group of monkeys. And what you saw is that they gained about 5.4% body weight. How much is that for a person who has 70 kilos? Well, it's about 3.8 kilos more greater weight gain if you had a high trans fat diet. And you see here, the difference is monkeys with trans fat diet had this weight over the years, during 6 years, already in the beginning, there's a difference, and plus 7.2% of body weight here at the end of the 6 years. While here they gain just 1.8% of body weight if they had a cis monounsaturated fatty acid. So there's a supplement of 5.4% weight gain, which is mainly fat loss. And it's mainly abdominal fat. We know that abdominal fat is worse. It gives more health problems. Well, they had 26% more abdominal subcutaneous fat and 33% more intra-abdominal fat deposition. So here, total abdominal fat higher with trans fatty acid fat diet, and abdominal is more in the inside of the abdomen than subcutaneous. So it's more visceral fat, not very healthy. And you see pictures, for example, cis fat diet, but the monkeys on the trans fat diet on a CT scan here, you see the difference. Much more fat here is there. What is the effect of soft drinks and high carb diets on hormone levels? Because if you lower the hormone levels, you increase your weight very often. So let's go and take oral glucose tolerance test. In the sugar you have to take in the oral glucose tolerance test is similar to the sugar in a milkshake of one of those big hamburger restaurants, big milkshake. And 40 minutes later, there's a lowering of the growth hormone that provides also psychological problems like anxiety, lack of recovery. Low cortisol 40 minutes later gives more stressed feelings and you lack energy. There's a lowering of the DHEA and androstenedione, other hormones. So your mood goes a little bit down and energy also. Aldosterone goes down, your blood pressure can go down. You can feel empty-headedness because you took that. And there's a lowering of estradiol. And you get constant tiredness and more or less sexuality. It's also lowering of testosterone levels. Constant tiredness again and less sexuality. So you impair your life by taking it. You get a kick by taking that. During 40 minutes, you feel better because of the sugar, but then the hormones go down. And during hours, you're hormone deficient with these sort of drinks. And that's generally for all sugars. Now, also very important when you have, as a health professional patient, you have to help this patient reduce the appetite. The appetite is too much. And you see that what happens is that this is the number of overweight. We're about overweight or obese adults in a lot of regions, 14 to 17.9%, a lot of regions of the United States in 1994. But it gets worse. The hamburgers got bigger. 2000, look, you even had areas with 22 to 26% of overweight or obese people. And now in 2008, and it's probably even worse now, you see a lot of regions with more than with 26 or more percent of overweight people. So it keeps on growing, but the food got more bigger and bigger, as you could see at the hamburgers. So it's not only hamburgers, of course, but gives an idea we should reduce the food intake. And the appetite has grown over the years. Why did the appetite grow over the years? Well, how can you reduce the appetite? There are many different ways. One of those is to sleep sufficient, more than 8 hours at least. That decreases the appetite as strong as Ozempic and all the other glucagon-like peptides analogs. Frequent short physical activities is very helpful to reduce the activity. Don't stay on your chair for hours. And many other things. Chew foods 5 times more. Drink water and soups helps. Avoid coffee, soft drinks, and alcohol. They all increase appetite, so avoid them or decrease them. And take nutrients that can decrease appetite, like chromium or 5-HTP, carnitine, also cysteine and others. So if you do all these improvements, you can calculate you can lose between 4 to 40 kilos, depending on what your weight is, in 1 year just by eating less because you succeeded in reducing your appetite. And for example, this study on a 13-year-long study on young adults showed that those who had a short sleep, slept less than 6 hours per night, have 7 times more risk of becoming obese, a BMI of 30 or more, compared to who had an average sleep duration that was between 7 and 8 hours. So sleep more. And actually, the sleep has decreased very much since 60 years. 60 years ago, people slept 8 to 10 hours. And if they didn't really sleep, they stayed in their bed resting. But now, most people just sleep 6 to 8 hours and they don't rest. They have even a more hectic life in between, outside of the sleep. And so you just by increasing your sleep, and I increased my sleep by 4 hours. I slept very little before, and I can say that now I sleep between 8 and 10 hours. My appetite decreases, and my weight also decreases. Frequent short physical activities. Let's look at what the science says us. This is a study on 61 overweight men, and during 13 weeks, they were put on moderate exercise to lose weight. And they exercise where they lost 300 calories per day. And that's a 30-minute per day aerobic exercise. And they were compared with people who, similar men who had high intensity exercise in the sense that they did longer exercise, 1 hour and not half an hour. And so they consumed 600 calories per day by doing the exercise. Now, what does it do on the weight gain or the weight loss? On the weight loss, those who actually had just 30 minutes per day lost actually more weight, 3.6 kilos body weight over 13 weeks, 4 kilos of fat loss in that. Well, you see that it's very similar, but still it's less body weight loss, 1 kilo less about in the men with high exercise, while they consumed more and they had slightly less fat loss. And so they had a similar body weight decrease, but a little bit better for the 30 minutes because actually those who did 1 hour had more appetite. It increased their appetite and they had a higher food intake. And so finally, they didn't really have any benefit. So you just need to do 30-minute exercise per day, 30 minutes of a little quick walking or slight jogging, moderate jogging. That's enough. and that's even optimal to lose weight. And also, it's important to chew more. We don't chew enough. We eat too quickly. And then we don't absorb the amino acids from meat, for example. If you have big pieces that you swallow, don't think that your intestines is able to compensate for not chewing enough. This is Horace Fletcher, a doctor who actually said you should chew more, and he cured a lot of diseases by making people cure more. If you chew more, for example, meat, you have more gastric acid production, so you will be able to digest meat much better and the amino acids from it. And so that was his method to prevent gaining weight and other diseases. And so here's a study in China, I believe. 14 obese young Chinese men were studied compared to lean young men. And what was seen is that those who were obese actually didn't chew so much. They chewed less and they had similar intake, but they didn't chew that food very well. And so they also ingested more than other people. In the study two, they tested a meal that the people, these Chinese men had to take. And they asked on some to just chew 40 times per bite of 10 grams of food. And so against those who did just 15 chews per bite. And that made that there was less food intake in those who chewed more and less calorie intake, 40 grams of fat per day less. And that is 15 kilos per year of less fat accumulation or intake or fat accumulation. So it also decreased the hormone that increases appetite, ghrelin, after the meals. And you had an increase of glucagon-like peptide 1 that decreases appetite and cholecystokinin that also decreases appetite. So really do better for your hormones. And you see this calorie intake is less in those who are lean and have more chews than the lean with less chews. And obese also who have less chews, there's less calorie intake. What about nutritional supplements to reduce overweight and obesity? Are there really nutrients that can make a difference? Well, when you look here at overweight, non-insulin dependent diabetic adults, they have to lose weight. And they have actually in diabetes less brain serotonin that decreases appetite. They also are more hungry and they crave carbs when you have diabetes. And 750 milligrams of 5-HTP was given, which is a too large dose, makes you sleepy. Wouldn't recommend, but it shows the efficacy is that they really had much less carbohydrate and fat intake in these individuals when they were taking 5-HTP and have less calorie intake and less, and they lost a lot of body weight this way. So are there amino acids that can decrease your food intake, decrease your appetite, and thus make that you eat? Well, in rats and obese mice, amino acids have been checked. And to see if they decrease appetite. And there are several amino acids that can decrease appetite, but the best of those that were examined was cysteine. Carnitine can also decrease appetite, was not checked here, but cysteine was really the best, whether it was given orally or into the peritoneum, and it was the most anorexigenic. And so cysteine was then given to healthy adults. And for an adult of 70 kilos, it's almost 5 grams of cysteine that was given per day. And you saw that it significantly decreased the hunger. So it really works. And how hungry do you feel was the question. And you see that was L-cysteine, less hungry. Also, how much could you eat? Less was L-cysteine. So it is significant that more or less 5 grams a day to decrease. And what is also interesting is that you can lose weight by taking probiotics. Among those, lactobacillus, acidophilus, bifidus, the Saccharomyces, etc. So to improve digestion, you might have to block yeast and harmful bacterium overgrowth, food digestion, and vitamin B9 production. And so what are the physical signs when you have a dysbiosis? Well, look at the belly. That you almost sure have a dysbiosis when they have a bloated belly and that remains bloated. That person needs probiotics, probably needs also to improve the food intake and the food choice, but basically that's also a need for probiotics. And so let's look at people who are obese or follow a low-calorie diet. Those who follow the low-calorie diet and receive probiotics, in this case, it was Bifidobacterium, was a subspecies selectis, and they also received a food for the probiotics, called prebiotics, full fiber generally. And compared to those who followed the same low-calorie diet but had placebo, there was a significantly greater weight loss in the patients receiving the probiotics. And the researchers thought, how does it come? Well, they estimated it was because the probiotics decrease inflammation. And when you are less inflamed, you have less water retention and your calorie consumption occurs better. What about slimming hormone therapies? Part one shows what thyroid can do, growth hormone, IGF-1, and testosterone can do in men. And let's look at thyroid supplementation. This is a hypothyroid patient. And what is the mechanism behind the fact that hypothyroidism increases weight? Well, when there's hypothyroidism, low thyroid function, there's less fat breakdown. So you accumulate fat mass more. And it's not only that there's too much fat, there's also an increase of what is called myxedema, waste products that are accumulated between the cells. It's mucopolysaccharides. From there, the name edema, mucopolysaccharide edema, myxedema. And with the thyroid treatment, you see the difference. The finer face that you see is not only decrease in fat, it's also decrease in myxedema. That gives the weight loss. And thyroid therapy can reduce special fat accumulation or overweight zones. Puffy face, the puffy eyes and cheeks, that's typical for low thyroid. The swollen breasts also can be decreased. The bloated, obese abdomen, there's a sort of even an increase in size of the colon, megacolon, often in hypothyroidism, takes more place. The megacolon also due to the thickening of the walls with myxedema. And there's also swollen calves. Very typically, it's typically due to myxedema. It's a non-pitting edema. And swollen ankles and feet. And so thyroid therapy can decrease all these parts that you can see in your patients. And what is best? Is it thyroxine that is mostly given, or desiccated thyroid, the old-fashioned therapy? Well, the old-fashioned therapy is better for weight loss. Desiccated thyroid compared to levothyroxine, patients who use one treatment and then the other for 16 weeks, you saw desiccated thyroid extract, there were more than 3 pounds more weight loss and 1.3 kilos more loss of weight. And so this person is more hypothyroid, less hypothyroid. There's a decrease. Now, the patient who preferred desiccated thyroid, they said, look, I like it better. They didn't know which one they were taking, but that they found better. I had lost even more weight, 1.7 kilos. So now it's very important, and I have already given that information in other webinars, is that don't overload your liver at night with amino acids. Don't eat proteins, animal protein in the evening. Even plant protein, be careful, but especially animal protein, because they accumulate in the stomach the whole night if you eat in the evening. And then amino acids are released that go into the liver, are absorbed, and slow down the conversion of T4 to T3. So T3 is the most active thyroid hormone. There's less active thyroid hormone there. There's a T3 hypothyroidism in people who eat protein-rich meals in the evening. So the classical meal we eat in the evening with meat is not the good meal for the evening. So you have a low T3 syndrome. So that's typically, you see that when you eat proteins, they accumulate in the stomach during 3 to 9 hours. So on average, 6 hours. But if you eat at 7 o'clock and you go to sleep at 10:30, for example, they're still in the stomach, most of those animal protein. And there's not enough gravity for it to go down and to be further digested. So you have an accumulation and a lot of amino acids getting through during the whole night into the liver. And there's insufficient body movements, insufficient bowel movements. So that person will be low thyroid in the morning, wake up swollen face, puffy eyes, and stiffness all over and low energy. Another therapy that is among the most efficient to improve the body composition and make you lose weight in a healthy way is growth hormone treatment. You see that if you're in the lower 75% of the reference range of young adults, what you see is that there's a higher BMI and weight in these categories. There's more risk of having metabolic syndrome features at the levels. There's more obesity, more visceral fat mass accumulation. So you better be high normal of IGF-1 to have a lower weight and less risk of metabolic syndrome. And when you provide growth hormone to patients, they are like this before, 6 months of treatment at a relatively high amount. Dose is a little bit high, I find, for wouldn't give that easy to my patients. But anyway, they get this monotherapy with growth hormone. And what you see is that they increase in muscle mass. They had more fluid volume, more water in them, and 6 kilos less total body fat. Especially the visceral fat decreased by 30% with this therapy over 6 months, with higher IGF-1 levels, much higher, and then also the thyroid function, at least the total and free T3 were higher, and they felt much better. Psychiatric scores were less. And when you look here at the CT scan of the abdomen, you see there's a lot of fat here, a lot of fat there, and retroperitoneal fat also. This is the visceral fat, subcutaneous fat. And when you see remarkable improvement after 6 months of growth hormone treatment at a relatively high amount of growth hormone. Also, here's a study. You can associate IGF-1 and growth hormone. IGF-1 is different. Growth hormone increased the levels of IGF-1, insulin-like growth factor 1. Those are the two major hormones to reverse aging, to rejuvenate a person. And the growth hormone treatment was given here for 12 weeks, 6.6 kilos less fat mass. If you add IGF-1, the results are even better. You have almost 6 kilos less body weight and 8.8 kilos less fat mass. So IGF-1 is less efficient than growth hormone to lose weight, but it does help. And when you add two, you have better effects. So I take personally growth hormone and IGF-1, and most of my patients above age 50 receive both treatments. Now, growth hormone therapy, what does it reverse? Well, it reverses the aging, flabby face, so it makes your face firmer. It increased the fatty neck, the pseudogynecomastia and droopy breast, the obese, droopy abdomen, the cellulite, and the fatty cushions above the knees. So all these things can be, especially when the belly is droopy, growth hormone lifts it up. So you really, even the fat on the back, you can have on the lower neck, also decrease with growth hormone. What about testosterone treatment in men? Well, this is how a man should look like. Ideally, very healthy. And this is the testosterone deficient body. You see, it's not as firm. And there's gynecomastia, accumulation of fat here. Pseudogynecomastia is fat more with testosterone, but it can also be, there are more estrogens, the real gynecomastia. And there's muscle flabbiness, abdominal obesity. And so you see here that the men who have low testosterone actually have this sort of body, and then progressively, if you increase the free testosterone, the muscle mass increases, and it's better and better and better, and that's the final picture with high testosterone and free available. You still need to have that shape, that body, to do exercise. Testosterone improves the muscles and decrease the fat on areas where there's exercise. That's really fundamental to know. And for example, middle-aged obese men receive transdermal testosterone therapy. The abdominal fat decreases. And interesting, when they receive transdermal dihydrotestosterone, dihydro is the one that actually, the male hormone that gives you facial beard, makes you lose hair here, get body hair on the body, get sexual characteristics, better penis and things like that. Well, that hormone is not good for weight loss. You see that there's 7% more abdominal fat and placebo, no significant changes. So transdermal dihydrotestosterone would rather increase abdominal fat. So you need mainly testosterone to lose weight. And also visceral fat was slightly increased with transdermal dihydro, while it was decreased by transdermal testosterone. You do see that the results are not as good as growth hormone. Growth hormone is more potent to decrease the fat in the abdomen and to decrease the body weight and etc. So here's a testosterone deficiency before, same man receiving testosterone. You see the change in body. Of course, probably there was also a better diet here. And now let's look at other hormone therapies. Testosterone in women, female hormones in women, cortisol, DHEA, oxytocin, melatonin. And also weight-increasing hormone excesses that you have in the session 6 of the model on weight loss management, insulin, estrogen, and cortisol. So let's look at testosterone supplementation in women. What we know is that there's women with more abdominal fat have actually loose abdominal muscles, also due to testosterone deficiency. So women can accumulate fat there. There are some contradictory studies showing the opposite in heavy women, but this study in 2012 shows there is more abdominal fat in women with low testosterone. Interesting is that testosterone can decrease cellulite in women. It's probably the most potent treatment to reduce cellulite in women who exercise their thighs. And you see here in premenopausal women with androgen deficiency, they receive a testosterone patch. It increased the muscles in the thighs, made the thighs firmer, and increased the lean mass, and there was no change in fat mass. So it mainly is an improvement of the muscles. And also we have information of women who want to become men, and for that they receive testosterone injections. So female to male transsexuals. And you see that after 12 months of intramuscular testosterone injections, actually what happens by this change is that the visceral fat did slightly increase in these women, but the subcutaneous abdominal fat, the hip fat, and the thigh fat all decreased. So also the thigh fat decreased here. Of course, at higher amounts. I do give some higher amounts in some women because, especially when they're collapsed or have a lot of cellulite, and it also helps if they do exercise to get better thighs. But you need then, in order for these women at higher amounts of testosterone not to masculinize, to give them a blocker of the conversion of testosterone to dihydrotestosterone, such as finasteride, for example. So what can testosterone therapy reverse in a woman? The fatty arms, the fatty breast, and the cellulite. What about female hormones? Interesting is to see is that in obese women with a BMI that are overweight women, BMI of 26 or more, that compared to women who have lower BMI, that they actually have less estradiol, less estrogen. The basal, the peak, and the mid-luteal serum estradiol is lower, and they have less possibility of getting pregnant. And when you give an estrogen therapy to women in the postmenopause, they generally tend to lose weight if you provide transdermal estradiol and not oral estrogens. So body weight, you see, is actually lower with transdermal estradiol, even also with oral estradiol. But what is interesting is the lean mass is increased in women with transdermal estradiol. So the firmer body, less fat, more muscles with transdermal estradiol and not so necessary with oral estradiol. What about DHEA? Well, interesting, 6 months of 50 milligrams of oral DHEA in women who were about 71 years of age showed that it decreased the fat mass. There's more fat here than there. It was about 10% less visceral fat in women, 7% less visceral fat in men, and 6% less subcutaneous abdominal fat. So it does help significantly, but at 50 milligrams, which is an okay dose for a man of 71 years, but not for a woman of that age. Generally, it's a too high dose. So it can give masculinization. Melatonin supplementation, 8 milligrams per day of melatonin, decreased the waist circumference, decreased the triglycerides, maintained HDL cholesterol, decreased systolic blood pressure. It actually improved the metabolic syndrome. 2 times more patients with 8 milligrams per day at night for 10 weeks lost, actually became free of the metabolic syndrome. So melatonin at high dose, this is an overdose normally, at high dose does that effect. And it was well tolerated by the patient. Now, what about slimming appetite reducing hormone therapies, the glucagon-like peptide analog agonist? Well, you have the very long-acting tirzepatide, or Mounjaro, or semaglutide, Ozempic, Wegovy, or the Victoza, Saxenda you have to give every day. This is once per week, these other ones. And a review of 8 trials showed that with semaglutide, you lose body weight because it decreases the appetite, and a little bit more at higher amounts. I do believe that this is generally too much, 1 milligram per week. 0.5 milligram depends on how the appetite is. And you can have the same effects by making patients sleep more. That reduces their appetite tremendously. We're not made to sleep just 6 to 8 hours. We're made to rest 8 to 10 hours. Yes, me who never slept a lot before, I tell you, I'm sure of this and I'm convinced. You see here that body weight change is more with tirzepatide than semaglutide. But look, doses are much higher. So it's not dose. It's not based on dose. What about human chorionic gonadotropin? Very cheap treatment. It also can give weight loss. Now, interesting is that it works in, I would say, imbalanced weight excess in people who are very obese, for example. And those who respond well to treatment have usually diencephalon deficiency, have disproportionately large size of the 2 upper front teeth. They have also a dimple. There's this sort of indentation, slight depression here on both sides of the sacral bone. And when they have the arms outstretched, they have palms upward. What they have is that the forearms go to the sides. Like here, you see, it goes to the sides. Those respond well to this sort of treatment. And they usually are also with the legs that go outside, bend outside. And so they cannot bring their feet together without overlapping the knees. And the dose you should give of chorionic gonadotropin, you should mix it with bacteriostatic water, very important, because often it's given with vials without bacteriostatic water, then doesn't preserve. You have to mix it with something that preserves and put it then in the fridge. And then take a certain amount out. You need about 125 to 150 units of ACG per day. That's generally, if dilution is 1,000 units in 1 milliliter, it's 0 to 1.25 to 0.15 milliliter in each injection. So studies have shown that may not work. Some studies that works in placebo-controlled trials, but most not. Why? Well, why? Because they don't use bacteriostatic water in the solution. That's very important. It doesn't preserve then. You usually take 1 vial for 7 days, and you give us an amount every day. So, but there are other reasons also to don't give enough and things like that. But the main reason is don't use bacteriostatic water. And then the solution perishes quickly. And so there are also slimming appetite-reducing hormone therapies like leptin and MSH. Leptin, look the difference before and after. This is a child of 3 years, 3-year-old boy, 42 kilos, 32 kilos at age 7. So 4 years later, he lost 10 kilos. He didn't take more because of growing. He grew, and that's leptin therapy. But it works mainly in people with leptin deficiency. Leptin is a hormone that decreases appetite. So this boy had tremendous appetite. And then TRH, supplementation. There are 4 species of bees and mice that were given TRH. TRH is thyroid-releasing hormone. It stimulates the secretion of TSH. It's a hypothalamic hormone. And when you provide it, it works to decrease obesity and body weight and by mobilization of triglycerides, and it works in almost all species of obese mice, except those who are genetically programmed to be obese. So if you have a woman like this that looks hypothyroid, she may have it because of a TRH deficiency, and then the TSH is very low in the blood. And if you treat her, she probably could be like this. We have not easy TRH for treatment in people, so I didn't see studies in humans, but this is probably what would happen if you have the adequate dose. The adequate dose would be orally something like 50 to 60 milligrams per day, like sublingual TRH. Reducing appetite, increasing hormone. Ghrelin really gives in animals terrible appetite if you give them. So if you reduce that hormone that increases if you don't sleep enough, that's good. So by sleeping more, you can decrease it, and many other ways to do it. You can see this in the session. Now, there's also a session on local fat deposits caused by hormone deficit excesses. Obese sheiks, for example, the puffy sheiks of low thyroid, or the swollen sheiks of actually estrogen excess or thyroid and progesterone deficiencies, or the reddish swollen full moon-like sheiks of people with too much cortisol. And behind that, there's also some hormone deficiencies. When you have a hormone excess, often you have some hormone deficiency that permit the hormone excess. Obese buttocks, also the fatty buttocks these are the insulin deficient buttocks, and this is insulin excessive buttocks. So if you have droopy buttocks, that's also like it's a lack of insulin. If you have too big buttocks with a lot of fat, that's insulin excess, fatty buttocks. But can be reversed by growth hormone and testosterone treatment, but also by adequate diet. And then there's this diencephalon deficiency with a lot of signs of obesity. We saw already those dimples that you have around the sacral bone, but they also have white scar tissue, often because of stretch marks. That's also a sign those patients can respond well to ACG treatment. The white lines are due to old striation. So in conclusion, we can say that there's local fat deposits can be reversed. Almost anything can be reversed with the combination of hormone treatment and good diet and a lot of psychological and lifestyle interventions. And I want to give you some information. I have a whole educational program about COVID infections, of the evidence-based hormone therapy, postgraduate inflammation, inflammatory disorders, reversing physical aging, which is the course that is the most sold. Very, very fascinating. Female hormone supplementation, chronic fatigue and burnout, thyroid diagnosis and treatment, melatonin, testosterone in men, testosterone in women. So really, this is you can put your mobile phone and picture that and get onto the hertogmedicalschool.eu, where you really get the information that helps you in your practice as a health professional to improve the health of your patient. And we have also the hormone therapy consultation. You just want to do one module and know much about hormones. This is the module to do. And there are more sessions actually than indicated here. Adrenal hormone therapies, growth hormone, IGF-1, psychological disorder, very fascinating, anxiety disorder, stress, depression, and autism. Longevity, very interesting, fascinating, very helpful to live longer. You know a lot of things. Also, they'll special tips from centenarians how to live longer. Sexual disorders, very, very efficient information, very valuable. Cardio and cerebrovascular disease, which is probably the top lecture of all or model. Weight loss management, which is really, really good here, very updated, as you will see. And you can also have courses. This is of the weight loss management. All the courses that I showed you are here. Really, really interesting with the hours that takes and things like that. So you really get a lot of good information. Remember those that there are a lot of books. If you just need to buy one book, this is the book to buy to get information. This is the second book to buy. It gives you all the pictures of hormone deficient excesses. And growth hormone treatment, my latest book. This is really, I think, a breakthrough book. Just need to read it and you will understand why there's a lot of dynamite and protects a lot of physicians to give these treatments, will motivate physicians, fascinate physicians how to give these treatments. So this is really a very good book. Reversing Physical Aging, textbook. If you want to reverse aging, you get a lot of recipes here, but really strong science behind it. Testosterone, also, all what you ever dreamed to know about testosterone. So these really are the main books. This is my latest book, Growth Hormone Treatment for Adults. And there will be a nutrient therapy. There's a nutrient therapy textbook and lifespan anti-aging medicine are textbook that really give whole information on those topics where you even can do an exam on it. There's congresses will be there in Seville in Spain in October and Mexico City where I give workshops. Also on reversing physical aging is a topic here. A full 2 days in English, but translating to Spanish. I will talk also in Belgium for pure encapsulation here about nutrients to increase energy and decrease fatigue. And in Rome, I will be also on nutritional therapies, talking a lot on how to increase hormone levels with nutrients and the immune system with hormones and nutrients. And then December, Las Vegas, topics will be confirmed. There's also a job offer for a health professional in Amsterdam, medical doctor. There's several requirements, but really interesting. And I will be there supervising also. So it's really interesting. If you want to retrain yourself, be a very top doctor, there's really a possibility of my working there. There is a demand to be fluent in Dutch next to English. And then there's patient manager that they need to be fluent in Dutch and English with a lot of experience. You can read these slides. You can look at this lecture also later on Facebook or other programs. So thank you also to our major partners that we have here, including Qualivita, that is also working a lot in the Amsterdam section. And we have also our people from Brazil that helps us, people from United States and Europe, etc. So if you want to contact us, these are the contacts number, hertogchannel@gmail.com. And if you want updates, here you have the information. And so you just can join on our LinkedIn and others like this. I'm going to stop sharing here my slides. And Andrew, can you put your audio and your video on so I can interview you? So I'm really happy to be able to interview you. Now, Andrew, you did talk about me that you have an interesting approach is that you treat also people that have a special disease of their home. Their home is not safe, is not healthy enough, and so they can increase in weight and have actually a worse health. So can you talk about this? What is your approach there?
Thanks. And yes, as you were talking today, just about every challenge that leads to weight gain that you mentioned can be directly instigated by someone who's living in a home that is unsafe. And what I mean by that is usually because there's some form of water damage and microbial growth. And the impact on the people living in the home cannot be overstated. It generally starts with excessive inflammation, and that inflammation accumulates in the brain and the rest of the body. And then there are secondary and tertiary consequences that begin to unravel throughout the person's physiology. And as I said, I mean it. Just about every area of sort of physiology and health that you mentioned, I see as a consequence in people who are living in an unsafe home.
And so, how many people, for example, with excess weight, would have benefit from having a healthier home? Is that 30% or is that 100% or 10%?
All of them. I mean, I think, when you start talking about pathological inflammation, and its deep role in the setting of weight gain and difficulty losing weight, you cannot overstate the impact that the home itself can play in that capacity. And I would say most, but not all of my patients have gained some or a significant amount of weight because they're living in a moldy home. And it's something to behold. In fact, when I have a patient who comes to my practice and they're complaining of excessive fatigue, um, weight gain of anywhere from 40 to 60 pounds that's unintended, and a variety of other symptoms, it's almost always the home until proven otherwise. What's really difficult for these patients in particular is that usually by the time they reach my medical practice, they've already tried to change their diet. They've begun to implement some sort of exercise regimen, and the weight won't come off, and they don't know why. So this almost ends up being a diagnosis of exclusion, that if there are other reasons why they've gained weight, typically speaking, the sorts of strategies that you've mentioned, intermittent fasting, improving the quality of the diet, exercise, hormone balance, improving gut function, all those things tend to work. But what I find is that in my patients, they've already typically tried many of those things, and the weight still won't come off, and they just don't know why. It's incredibly
So,
frustrating for them.
now how would a patient or anybody recognize that the unhealthy part of their home? Is it mostly in the living room or in the kitchen or in the bedroom or all over? And how do they recognize on the walls? Is it paint that doesn't hold on the walls, for example, or I don't know.
So there's a few sort of vital signs that we have people look for in the home itself. The first is if there's a known history of water intrusion, so a leaking pipe or some sort of flooding in the past. Um, uh, an event that was sort of identified. Beyond that, we also know you can get microbial growth when the humidity in the home is 65% or above on average. So it's really important to control humidity. So you don't need a leak to get some microbes to grow. In addition to that, and this has been sort of a breakthrough in our research that we've published, it turns out that if there's any musty smells in a home, even if there's no history of water intrusion, there's likely a problem. But the breakthrough for us was because we identified something other than mold that's likely growing in the home, causing the musty smell. And in fact, it's a form of bacteria. And this bacteria can accumulate in pipes. It can accumulate on relatively dry surfaces in the home. And what's been really surprising is this bacteria can even potentially colonize, of all things, the patient's skin. That wherever they go, they bring this microbe with them. It has a name. It's called actinomycetes. And actinomycetes is showing itself to be a pretty bad actor in the home. We used to think it was all mold, and now we know there are other types of microbes that can really make people sick.
And so, how do you treat that? You have a person who has, of course, they probably have to arrange the leaking water, and they probably need to dry a bit the rooms. But how do they arrange it also on the health? Because they have it inside of them, I suppose, the mold and the actinomyces are on them.
So, this is the great debate. How much do these compounds accumulate in the tissues and organs? Do they move through the circulation system? The biggest problem is probably the inflammation itself that begins to appear in the brain and the rest of the body. It took our research group a long time to be able to measure and identify the part of the immune system that was actually reacting to these exposures. And typically speaking, more common markers of inflammation don't go up in the setting of a water damaged building. So white blood count, CRP, STED rate, immunoglobulins, they all tend to be normal. And so this was a hidden source of inflammation that we found is coming from a very specific part of the immune system. But once we learned how to measure it, we knew we had a chance to potentially control it. So we have a variety of approaches to reduce inflammation in our patients. And at the same time, we have to ensure that they start cleaning up their home so that the source or cause of inflammation is controlled as well.
So you didn't find that the classical markers of inflammation increased. What marker then did increase? Or is there something specific you can measure?
There are. And so this gets to what I would call immunology 101. There are basically two sides to the immune system. There's the innate immune system, and then there's the acquired or adaptive immune system. And much of medicine concerns itself with measuring markers that arise out of the adaptive immune system. So autoimmune markers, general markers of inflammation. But the specialized markers that we found that were elevated in this patient population was coming out of that other side of the immune system called the innate immune system. So these are markers that aren't generally drawn in clinical practice, but are incredibly valuable. What's interesting, and I think, Terry, you'll find this fascinating, one of the key markers that declines over time because the brain becomes significantly inflamed, especially the hypothalamus, is melanocyte stimulating hormone.
Oh,
And as you know, as MSH levels fall, MSH has been implicated in everything from melatonin production to the integrity of tight junctions along the leaky gut. It helps to control aromatase activity. It supports normal immune response. It helps with general hormonal balance. It helps with metabolism and normal weight. You can't overstate the role of MSH in particular. And just about every patient of mine that has had an exposure because of the brain inflammation, we see a low MSH. Now, there's more than that going on, but the impact on the brain in particular can't be sort of overstated. So we measure MSH, we measure other markers too. Transformation growth factor beta 1 or TGF beta 1, vascular endothelial growth factor or VEGF, matrix metalloproteinase 9. We also measure the alternate complement cascade, so C4a and C3a. These are interesting markers. They reflect innate immune activation. But again, it's a language and an approach that we don't normally see in sort of standard medicine, but it's a set of invaluable tools for me.
Do you then see an improvement with the treatments you give? They get up or they
Absolutely.
Get
Yeah. So we do. We see a resolution of those markers, so they all typically improve. Inflammation levels decline, and as a result, people's energy levels go up. They lose weight. They feel more vital. We've also shown that this inflammation, if left unchecked, actually damages the brain. That mold can cause a brain injury, and that brain injury almost looks like a traumatic brain injury. So we have a whole series of MRI studies that we've published to show that it's not just metabolic consequences and hormonal derangements that people are dealing with, but there's a real serious end result in a portion of our patients, which is an injury to the central nervous system. And we've shown with proper therapy and treatment, we can even potentially reverse the injury to the brain.
Because you also talked that they have a sort of post-traumatic stress syndrome, actually, that actually cures with what you give. And you see many of those people with overweight, with great overweight, they're often traumatically stressed. So they would lose, those people are probably having also this home problem.
They do, and it happens on a couple levels. We see an impact on the integrity of the stress response itself. So as the brain becomes more inflamed, the crosstalk between the products that are produced from the brain, such as ACTH, which is the signal for the stress response, and the production of cortisol becomes, as we say, dysregulated. That a person's biological response to stress becomes abnormal over time. But beyond that, these patients tend to be very sick. They often fall into the category symptom wise of chronic fatigue, fibromyalgia, atypical depression, resistant weight gain, hormonal imbalances. They're very, very hard to treat no matter what. The disease itself becomes traumatizing. The mind is not safe, the body is not safe, the home is not safe. It's an incredibly disruptive illness, one of the worst I can actually think of.
And so you probably not only treat the mold and the bacterial overgrowth that there is in those, but also probably also maybe that there's too much plastic and too much toxins. Do you do that also? Because I was formed many years ago in the beginning of my career by the American Movement of Environmental Health that
Yeah.
was in Dallas. And I remember that even the walls in the paints, you have to be careful. They can outgas and make you sick. So it's probably a whole phenomenon, and you have to be very holistic, even just for the home, and very various. So you have experts working with you?
We do. And in fact, I couldn't do my job without those experts. So I work with a network of indoor air quality professionals, and they help go into the home, assess the sources of contamination, and then develop a what we call a medically sound remediation plan, which is a bit more aggressive and a bit different than, let's say, your standard mold remediation. Usually that doesn't go far enough for my patient population that really needs to be living in a clean and healthy home. And I always think this, we want healthy people in healthy environments. And we spend so much time measuring what's going on inside the body of our patients. And I do think that practitioners like myself have to develop this other expertise, which is asking the question, how do we assess a home properly? And how do we create a healthy home as well?
Do you have I know training program or book that people could read about that so they know what to do or have an idea or go to your center?
So I've edited a medical textbook, and it's called The Art and Science of CIRS, CIRS, The Art and Science of CIRS. And CIRS stands for Chronic Inflammatory Response Syndrome. Basically, it's another term to say, I'm living in a home and it's making me inflamed. So, Art and Science of CIRS, a lot of our technical information is there. Um, and yes, I have a clinic in Northern Virginia. It's called the Virginia Center for Health and Wellness. We take care of patients from all over the world. This is a worldwide problem. We know, for example, in the US alone, 50% of all structures or buildings have a water problem. And at least 20% of the population are particularly sensitive to these exposures. So not everybody who lives in mold will get really sick, but it's not an insignificant amount who will find themselves in relatively dire straits.
And so your book, your textbook, they can buy it on internet, Amazon,
They can
or
buy it
they
online.
can buy it
Yes.
on. Okay, so that's good. I propose that we might look at the questions that we have, and then we can both answer. So here's a word. Yes, everyone is different. What do you recommend for plant-based vegan who is trying to figure out food sensitivity, histamine issues? Thanks. Do you have a suggestion?
When I see histamine issues, I always think exposure. So there's a big overlap between, and this is my bias. We see activation of gene sequences that make people particularly sensitive to foods and become quite histaminic when they're living in environments that are not healthy. So one of the things that I would do is have the person begin thinking about what's the quality of my living space, and is this one of the reasons why I'm so reactive to foods in general. Uh, Treatment wise, there are products like diamine oxidase that reduce histamine responses. There are natural bioflavonoids such as quercetin and bromelain that can also help in that regard. The other piece, and I don't know how you feel about this, is sometimes if a vegan is moving towards raw, I find that sometimes that actually makes the gut work even harder to break foods down. So they may want to make sure that they're cooking their foods or steaming their foods to make it easier to digest.
Yes, there's a whole movement in Europe, I think also in the States, that you have histamine releasing foods, that you should avoid them, and that you should take more histamine foods that are low in histamine or do not trigger histamine. For example, unfresh food is not so good, but it's also probably with mold in it. So you have your home, you're eating what's also bad in your home. So I think plant-based vegan, they have to eat foods that are sprouted. The seeds are very toxic. They are the seeds you have enzyme inhibitors to block sprouting, and that blocks also digestive enzymes. So they have to eat sprouted food and not too much because that also gives sometimes is quite strong as a food. They have to, of course, take a lot of nutrients that they cannot absorb in a vegan diet, like iron and some trace elements and things like that. So the, there, there are some amino acids that they're missing that they should supplement, and the vegan diet is safer. Um, um, Here's another question. What about liraglutide? Saxenda, is that really dangerous? You can give it inflammation of pancreas and thyroid cancer. It's most studies are done in animals, so the likelihood is low in humans. But why would you use liraglutide if you sleep more and you have less appetite? And that's safer. You get very sick if you take too much. And I think it's more transitory treatment, and it's used now as a permanent treatment day long. I don't know what you think about this. Liraglutide, that is Saxenda, that's these injections, glucagon-like peptide analog.
My read of the literature is, there's some very large scale long term studies to suggest that we don't see an increased risk in pancreatic cancer. The last one, I think, was following 500,000 subjects.
Yeah.
With that being said, a healthy gut is one that produces plenty of GLP-1. And I think, as the brain goes, so does the gut. So as you say, sort of sleep, but also stress management and, healthy diet and a healthy digestive tract can go a long way. And, producing the markers that we need to have proper satiety and good metabolism. I think maybe there's a role for short-term use of these medications, but I don't think that they're a long-term fix. And I think that they have to be placed into a context, if at all, with healthy lifestyle. And as I said, sort of healthy people in healthy environments.
Okay, good. Here's one question: how to be in balance if you have high insulin and my hormone and is low? I suppose I don't know what the hormone and is, so can't really respond. So we'll go over it. But anyway, high insulin, you need to lose weight. But high insulin can also be a stress hormone. So if you reduce stress, you can also lower it. There are many ways to reduce the insulin. And here's Was there rice or grains in paleo? There's no rice or grains that are unsprouted in the Paleolithic type diet. It's all sprouted meals. There were some nuts, which are normally, I always propose patients to soak nuts, to put it during 8 hours at night. Almonds, for example. Hazelnuts is 2 days and 2 nights, and then it's much more digestible because many of those toxic substances that include those enzyme inhibitors, but also sort of pesticides that they have to prevent predators of eating them. You get sick if you eat unsoaked nuts, at least a lot. So there's no rice or grains in paleo diet, but some intake of sprouted grains would be okay. And sprouted rice also exists. Um, we explain that to patients. We have papers on that in our consultation. Now, can we eat plant proteins in the evening? Less. You can. It's better than animal proteins. It doesn't decrease the thyroid function as much, but it's not optimal. Best is not plant proteins, at least like beans and lentils, that sort of plant protein. And then let's see here, how not eating protein after 2 p.m. can ensure enough protein synthesis for muscle growth. Most longevity experts suggest eating enough protein for longevity. Yes, that's true. The range is 1 to 2 grams of protein per kilo of body weight, which is correct. But our body can only absorb 20 to 40 grams per meal. So you need 3, 4 meals protein to get enough. How do you reconcile that with recommendation not eating protein after 2 p.m.? So the recommendation is very strict in the sense that the idea is to make people think that they should avoid eating a lot of proteins in the evening. Now, if you eat small bits throughout the day and you eat less in the evening and still a small bit, that won't harm so much. The idea is to really make you think that it doesn't help much to eat proteins in the evening, except if you do exercise, take some protein or amino acids, that would be even better. You can increase muscle growth if you do it before, just after exercise in the evening. But don't do too much. If you get a bloated belly, that's upper belly, that's a sign that it's too much. So your upper belly should not be bloated. If you take small bits, it's okay. Do you have any idea about protein intake, or Andrew, or want to comment or not? No? Then, okay. And okay, that's good. Especially that's the same similar question. What is your meaning for Ozempic? So Ozempic, I do use it sometimes. I do use it much less because I find people feel sick, and I'm thinking that Ozempic is given to many people who don't sleep enough and who don't chew enough their food and who don't do all the things that they should do to be healthy, and who are living in too much stress where they don't express their emotions. So I think Ozempic, if a person cannot handle change his lifestyle, is okay for a limited time, but we have to help patients. But I like to treat the cause.
There's also some research that the GLP-1s reduce brain inflammation. They blunt activity
Oh,
of
is that?
microglial cells. And I have to say, in my patient population, when we do reach for some of these medications, they sleep more deeply and they feel better in general. And I think there's more going on than what we expect for this class of medication, at least in my patient population,
Yeah.
because it likely is reducing some of that central activation.
They did show, but it's firms that sell it did show that it's good for the heart, that it's good on several levels. Even for the brain, there were some studies
Mhm.
showing that there were
Correct.
some good effects. But what I do see in patients is that when they don't tolerate it, really don't tolerate it, they
Yeah.
feel bad, not only their intestines. So I think there are some patients that have to try on a low dose, and if they overreact, shouldn't take it. Start on low dose anyway. Are there any disadvantages of taking growth hormone? Yes, there's a lot of disadvantages. You live longer. You look better. You feel better. A very disadvantage in a society who sometimes focused on not being healthy. But I think it's always overdose. An overdose of growth hormone is also not good. Just find the right dose for everybody. For me, for example, I was exceptionally over sensitive to growth hormone. So I took during 30 years, yeah, I think it's already 30 years. I took an extremely small dose. I had to dilute my dose. I had to dilute 5 to 10 times. And now I take a normal dose for my age, which is of growth hormone is something is 0.3 milligrams. And I tolerate it well, but before it was 0.03 milligrams or even lower. So you need to find the right dose for everybody. And
Unfortunately, we don't have good access to growth hormone in the U.S. It's the regulations are incredibly strict, so I would prefer to use it more frequently, but it's very, very hard to prescribe it in the United States, unfortunately.
well, you are protected by the FDA, who has changed a bit this position, and we have legal text in my book on growth hormone treatment for adults. It's all explained. If you want, Andrew, I'll send you a book on growth hormone treatment. You have the how to do it in the United States, and there's a pharmacy in San Diego that sells it easy, and they know also how to do it legally. But it also may depend from state to state. There are some states with medical boards that are short-sighted, but I knew a doctor who was very severely sanctioned for using growth hormone, and he did trials. He lost his license for 3 or 4 years, and he got it back, and they had to make excuses. So you do have there are some precedence that shows it's okay. I personally, we had in Belgium, we didn't have so much problem. They did attack. I was even attacked for giving growth hormone to a patient with prostate cancer and testosterone, but I give the literature. So how can you counter the literature? There was so much literature I give that showed the safety of it, of course, at the right doses. That basically in Belgium they backed off, and so dosage for IGF-1 and growth hormone, yes, this is a really important treatment. By my book, you have the dose of growth hormone, but basically a dose is between 0.1 and 0.3 milligram on average for an adult. This can be higher or lower. And IGF-1 is about double dose of that. It's 0.4 milligrams of the real IGF-1, because you also have long-acting IGF-1, which is 10 times more powerful, but without studies in humans, and 0.4 milligrams to 0.8 milligrams in IGF-1 of the real stuff that we have here in Europe, that you don't have in the States, even more difficult in the States to get that. You do have long-acting IGF-1, and there you have to decrease the dose by 10 times of what I give, so 0.08, 0.04 to 0.08 milligrams on average. What is ideal testosterone level? I said it's Vanessa, so it's a woman. For a woman, in picograms per ml, it's around the 600 picograms per ml. And in men is around more or less average, but smaller people need less, bigger people or more muscles need more. In men, it's about 7,000 picograms per ml. I'm not sure about the nanomoles, but you can find all this information in my hormone handbook. Yes, a lot of questions on hormones, I see. I'll see if I can have some questions first. Yes, there's a lot of questions on hormones. It can replace red meat for people who do not eat meat. You can replace red meat by white meat, by fish, by eggs, but you have to vary a lot. Studies have shown that people who vary a lot have much less cardiovascular diseases in their disease, and people who eat healthier foods have less cancer. So it's very important to vary a lot. What is the insulin level? What is a good insulin level? Do you have an idea? Because I think you treat a lot of metabolic syndrome, no, Andrew?
For our range, an average, healthy fasting insulin is between 2 and 6. Here in the States, hyperinsulinemia is considered 22 or above. I don't like anybody above 10.
Yeah,
And
that's
I don't think we're actually aggressive enough with average glucose levels too. Our typical range is somewhere between 70 and 100. I like to keep people at least below 90 and closer to 80 if possible.
okay. I must say something about insulin. I'll give a lecture probably on AFRM one of these days on it. Is that if the insulin is too low, there's a lack of absorption of amino acids. So I totally agree with the level of 7 or 6 is good level or 5. However, when a person has 2 or 3, there's droopy triceps and droopy buttocks. I started at my age, 67, to get atrophy of muscles in several areas. I reversed part of that atrophy, or at least 50%, by adding insulin because my insulin was too low because of my diet. So I had insulin of 2 or 3, and it got tighter. My whole body got tighter because of better amino acid absorption. So the most age reversing treatment, actually, rejuvenation treatment, includes, in my experience, extremely small dose of insulin next to IGF-1 and growth hormone. And so basically, insulin of 4 is okay, but 3 or 2, in my experience, you feed these droopy buttocks, droopy triceps that reverse. I give a woman, for example, of about 70 years. She had a very sagging triceps, really sagging, impressive. After just adding insulin to her growth hormone and other treatment, it decreased by 3 times in 6 months. So it depends.
You're not going to find a lot of people in the U.S. with low insulin, I think.
Maybe
Yeah.
not in the US, but
Wait,
here,
yeah,
some of my patients are getting too low insulin because of their
yeah,
better diet.
yeah.
And uh,
That I can understand, but that's not a problem I tend to encounter.
okay, well, it's usually very thin people and who have muscle atrophy. It doesn't respond to growth hormone. Give them
Yeah.
insulin added, then it works. Um, then does the growth hormone not risk to increase or trigger a cancer? So studies show that when you give growth hormone to a large sample of people who are very deficient in growth hormone, they have 2 times less cancer and they develop 4 times less cancer mortality. Because growth hormone can stimulate in vitro means in lab cultures, cells, cancer cells to keep them alive and proliferate. However, it also stimulates immune cells. So on the body, it's much in favor of growth hormone. And so people who are very low in growth hormone have much more cancer. You decrease that. And studies have been given to give to cancer patients growth hormone, to children, for example, with brain tumors. They have 50% less mortality. A study, and not much studies have shown growth hormone being given to cancer patients, but there was one in people with gastrointestinal cancer, terminal cancer, they were dying. And growth hormone did not significantly increase survival, but there was about 2 to 4 months more survival in those patients, and they had a sort of remission of cancer much longer, like doubling of the period. So it's quite safe, really safe. You have a lot of studies with low IGF-1 linked to more cancer, like cervix cancer, up to 4 times more. So it's let's say it's safe. There are studies show that high IGF-1, which is a marker of growth hormone activity, are linked to more cancers, but there are also studies showing less cancer. And basically, there's not very significant difference. So it's very safe. I never saw patients really develop cancer who were taking growth hormone, in my experience. But we do a lot of treatments that decrease the risk of cancer with better food. We have some hormones that decrease cancer risk. We have vitamins, we have vitamin A, selenium, and things like that. So we do correct that a lot. Dr. Heyman, are there more biotoxin in homes in humid and hot weather regions?
We think so. As I mentioned before, if the humidity in the home is 65% or above, that's permissive for microbial growth. And certainly in hot weather environments, we think that there's, greater predisposition. Although we've been surprised that even when people live in dry climates, we can still see microbial growth. Sometimes that's because of the presence of the air conditioning units and the condenser systems, where you start to get condensation in the HVAC and the ductwork. Um, so, even though a number of my patients will ask me the question, should I move to a drier climate? We believe on average it's not a bad idea, but with the asterisk that you can get growth in just about any type of climate.
Okay. And I suppose air conditioning will accelerate the dispersion of all those molds and bacteria.
It does. And, so what we see is potentially growth of microbes and molds on the coils of the air conditioning system. And so even though air conditioning units are supposed to dehumidify the home, they actually can be a source of growth. And then they're blowing the mycotoxins throughout the home.
Here's a question. What are 5 simple things you can do to help the body heal after living in a moldy, unsafe home? If you have to choose 5 interventions, what would be?
I would say number one, make sure that you have good personal hygiene. It turns out that we can get growth of the actinomycetes, the bacteria on the skin. And so we advise our patients to make sure that they're pretty aggressive with using good soaps every day, and to ensure that they're scrubbing, especially in areas where there are skin folds, behind the ears, along the neckline, under the arms and the groin, behind the knees. This is where the bacteria tend to accumulate and release their what are called mycolic acids into the skin. And so personal hygiene is incredibly important. The second, I would say, is good sleep habits, because this is what helps to reset the immune system. Sleep can be quite elusive in this patient population, but it's very important for healing. The third is the cleanliness of the home itself. And we recommend something called small particle cleaning, which means that it's important to use a HEPA vacuum cleaner at least 2 or 3 times a week. We recommend, believe it or not, vacuuming the mattress at least several times a week, also with the HEPA vacuum cleaner. Cleaning fabrics routinely at least several times a week. And then also washing down ceilings, walls, and floors. We tend to recommend a very simple solution of water, dish detergent, and vinegar. That mixture is very good for ensuring that surfaces in the home are quite clean. The fourth would be air filters, and you want air filter technology that includes photocatalytic, UV light, and ozone, as well as charcoal and HEPA. There are a number of companies now that combine different technologies into a single unit. And these are very sophisticated. They are for home use for the public, and they can be incredibly important for helping to restore health. And then finally, we've looked at lots and lots of natural compounds that help to pull out the inflammation and toxicity that builds up in the system when you're exposed. And the 2 items that actually came to the top of the list by far was okra and beets. Okra and beets have certain compounds inside of them that are very good at grabbing on the inflammation that's unique to a mold exposure and pulling it out of the body. There are other natural treatments, but we've found that they're not nearly as good as okra and beets. There are now powdered supplements where people can take a version of dehydrated okra and beets throughout the day to begin to reduce that inflammatory load. So the treatment is multimodal. It's you have to deal with the home and you have to deal with your own health as well.
Okay, good, very good, because that's really very interesting. I would say we can immediately put it into practice. Here are some other information. Is there other ways to increase growth hormone without taking it with certain amino acids? Well, it works mostly with amino acids when you're young, when you don't need so much growth hormone. Then your pituitary gland reacts well to amino acids. In old age, it's only glutamine, mostly 2 grams per day, that can increase growth hormone, but never as good as growth hormone itself. So it's ideal is not to use a stimulator of secretion, but to add the growth hormone. And then you can always add a stimulator. Maybe you can lower the dose of growth hormone. But growth hormone is so important for your health, for your well-being, that I would say if you can, try to have a good growth hormone, take growth hormone. Here's it's in Spanish. Do you take fruits before or after foods? I think it's before, half hour before or 3 hours after meal fruits, because otherwise it rottens in your stomach where it should quickly be absorbed. So it goes into intestines. I don't know if you have other ideas, maybe, Andrew. No. And can you combine proteins with carbohydrates? Well, carbohydrates that are vegetables, yes, but I don't think it's good to put sweets or cereals. We have here food preparation in the neighborhood. You buy it, it's full of sugar with proteins. I don't think that's a good idea. So it's true that sports people take a little sugar when they take amino acids, and then they absorb better because it increases their insulin level. So in that sense, it may be of helpful. And you know that in the States, there's a controversy now about thyroid hormones, and desiccated thyroid preparation have been changed by pharmaceutical companies, and they decrease the sugar that there was in it, and then there's less absorption of the thyroid hormones, because putting sugar with the thyroid hormones makes that there's more insulin secreted and there's better absorption. So there's some controversy there that you might use some sugar for some amino acids you absolutely need for health reasons. Trying to see here questions here. Yeah. Very good. Yeah. Thank you very much for this lecture. My question is for Dr. Andrew Heyman. Which tests or tools do you recommend to identify the water damage house? Thank you.
So we actually use swab kits, and we have patients collect dust in the home. And because dust is where DNA material from the microbes accumulate over time, and it gives us a window into what's been growing in the home. We find that this is much more accurate than typical air sampling. Air sampling captures usually whole mold spores, and whole mold spores are about 0.3 microns in size. But it turns out that the inflammagens, as we call them, the very small molecules that we breathe in and make us sick, they're much smaller than that 0.3 microns. And those airborne test kits don't capture the sort of full problem that the house might present. In fact, we believe it misses maybe up to 99% of what could be potentially growing in the home. So we have individuals swab dust areas, and we look for mold, we look for bacteria, and we look for endotoxins. We also are starting to look for a fourth category called beta glucans. So the technology is really growing, and we're getting better and better at assessing whether or not a home is safe.
Okay, we'll have to finish because time is over, but there's still a question to repeat the name of your book. What is the title of your book?
The Art and Science of CIRS, CIRS.
CIRS. Okay. Thank you, Andrew. Thank you. Also, thank also the people. There were 2,200 people registered, less indirect. So there will be many people going further. And then you know that it's in which clinic that you are. It's in Pennsylvania or
Virginia,
Virginia, Virginia.
Virginia. Yep.
Okay, good. Thank you. Thank you for
Thank you.
everybody. Bye bye.